You know, a cholesterol of 300 used to be normal in the 60s. Well, it used to be normal in the 60s, die of a heart attack. That's the reason Medicare and Social Security didn't start at 65, because most people were supposed to be dead by then. We're fooling them, aren't we? Anyway. Okay, exercise, menopause. Exercise, you build muscle, you build your metabolism. Also, exercise lowers your insulin resistance. See, the problem is if you eat a lot of sugar and white flour, which everybody does, then your insulin resistance goes up. Your pancreas keeps kicking out more insulin, and pretty soon your cells become so overloaded they lose their sensitivity. Now, there are nutraceuticals. I have, in fact, at the San Bernardino office, I have treated insulin-dependent diabetics with the things I talked about here and nutraceuticals, and they got off the insulin. Okay? And that's kind of like a miracle. Anyway, and it's about, the diet. If you're a diabetic, you should not eat simple carbohydrates, period. I don't think doctors tell them. You go and see the diabetic diet, they always have a slice of bread and potato. Yeah. Because, go ahead, I'm sorry. Sometimes I get really mad because of the state of, I love being a doctor. But, and these poor guys out there, they don't know. They don't know. And so I hate to be so hard on them. But it's their job to know. You just don't, have a diagnosis and open the PDR and what's the next pill. No, that's not what we're talking about testosterone. Testosterone may be the wonder drug hormone for men. Okay? Testosterone starts to go down. All the hormones start to go down around 30. When men get to be about 50, they start getting belly, okay? They start, they lost a step, they're just not there anymore. They've lost their sexual desire and their erectile abilities a little bit.
But the insurance won't pay for it. Why is that?
No, because,
they'd rather have you be sick so they can...
Well, here's the thing. Well, let me finish what I'm going to say, because if the insurance companies were smart, testosterone, everybody knows testosterone helps you build muscle. Any doctor will tell you that. Any patient will tell you that. Well, what's the most stressed, hard-working muscle of the body? The thumb. Testosterone and DHEA may be the best treatment for heart problems. It improves the heart muscle, okay? And DHEA also. In fact, in China, also, now, proven testosterone improves cardiac circulation by 68%. Research in China. 68%, that's pretty good. And the reason you have a heart attack is you don't have enough blood going to your heart. Now you think that would be all over the news, right? But it'll come out next year and it'll be like a big deal. But they've known that in China now for 5 years.
But you got bean counters in the insurance companies that are saying it's 300 a month.
Don't tell me about how bad it is.
Yeah.
American medicine is a big scam. But there are good doctors, emergency room.
No, my doctor wanted to give it to me,
but
and the insurance company said no.
Yeah, right. But then the normal way we treat what really kills us, the chronic diseases, is horrible.
Oh.
And it's all about making a diagnosis. And you're not sick until a doctor can show an x-ray or a blood test. Well, for me, that's too late.
Of course.
Of course, it all makes sense. And they're just...
But it's expensive, though, testosterone.
Testosterone, well, actually see, again...
I just bought some.
Huh?
I just bought some.
How much was it?
It's not that expensive.
It's not.
For a month.
Yeah,
But-
subscribe it for me.
Right.
They want to charge $300 for...
That's expensive, and that's expensive. Now, see,
That's why they said no.
okay, here, I gotta give a plug to my sponsor here, Crescent Pharmaceuticals. They're here in Culver City, and they get wonderful compounding, but also they're the most reasonable price in town, and that's why I use them.
Can you write a prescription that I can get it from you to get it from them for $68?
Well, I gotta make sure that you need it, so you have to come in, I get to take a blood test.
Well, I understand that, but I'm saying, if
Oh
you
yeah,
came down to that,
okay.
because I can afford that.
Testosterone may be the magical drug for men. Okay, there's a lot of men that have all those problems. Belly, loss of muscle,
You can't afford it.
not feeling good, lost energy, and depression in men. The first treatment should be to look at their testosterone and their thyroid. testosterone, and I have men in this room that I've given testosterone to, testosterone changes your way of thinking. That is the, you know, and then understand that when you were 17, 18, you know, okay? There's no word for it, but men know, especially athletes, they know that feeling, okay? Well, here's so testosterone may be the wonder drug for men, and maybe the wonder drug for heart. Okay? Here's a poem, and we've all heard that the male sex drive moves the universe. It's what's behind wars, behind great art. Van Gogh chopped off his ear because of a woman. The male sex drive is a powerful thing. Well, our favorite poem, Octavio Paz, Nobel Prize laureate. I want to say he's Mexican, but I think it's proven. Anyway, he says, this is beautiful. He says, erotic love is a spindle around which all life revolves. And with testosterone, that's erotic love. That's erotic love, that's stamina, that's libido, and women need it as much as men.
That's how great cities got built and everything else.
Right. Women need it men. I see, one of my specialties with my card is sexual enhancement. And basically for women, give them testosterone. And then all of a sudden, you know, the men look better and better. Yes, ma'am.
I've been hearing or reading a lot about using bioidentical progesterone for men as well to
Okay,
help deal with
progesterone is a wonderful hormone. Again, it meets my 3 criteria. Number 1, no side effects, very small. And the reason it's so good, progesterone. If you've ever been pregnant and you had your baby, your progesterone levels were sky high, over 1,000. Progesterone, progestation. So we know it's safe, okay? So progesterone is a very safe drug. It's not expensive, right guys? Not that expensive. And progesterone, and I'm not the first one to say this, John Lee. Dr. John Lee, you read it? You read him? He's written 3 books. I read them all. If you're concerned about hormone replacement therapy, read his books. Read his books and come and see me. What?
I'm not concerned, I'm just saying I've been hearing a lot.
I'm not talking about you, I'm talking about
using it in
anybody.
men. Oh, sorry. Using it in men to prevent
Oh, yeah.
prostate issues.
Well, here's the problem with prostate issues, okay? And if you live long enough as a man, you're going to have a growing prostate, okay? And that's heralded by decreased sexual function, decreased stream, you know, getting up at night, whatever. And sometimes pain, but not always. And the prostate grows, and that's hormonal. There are things, I tell all my men over 50 years old, you should be on a prostate formula, okay? Proven that, and you have a prostate formula at the pharmacy? And we'll make one. Here's what it should include: saw palmetto, pygium, stinging nettles, and zinc. Make one up. Okay, now what that does is that protects the prostate from being the receptor sites. It blocks receptor sites from the dihydrotestosterone from connecting, and also from the estrogen connecting, and that's what causes the hypertrophy of the prostate. High estrogen. Here's a news flash. A 55-year-old man has more estrogen in him than a 55-year-old woman. Okay, because women usually go through menopause at 50, 51, and their ovaries stop working. And men, especially if they're fat, overweight, the fat itself, what it does is it aromatizes testosterone that they do have into estrogen. It's called aromatization. And there are safe ways to prevent that. And that's the image of person. Okay, see, and so once you prevent, see, you can have a man that has a high estrogen level and a high testosterone level, but a low free T3, free testosterone. Free testosterone is the active portion that actually causes the reaction. And the reason for that is that the man's high testosterone has been converted to estrogen. And you see it in men. I don't have it because I have a cure for it. You know, man breasts. You know, I used to have them, but they're gone now. I have a cure for that. combination of hormone replacement and also mesotherapy. We'll get into mesotherapy. But testosterone, one drug for men, heart and how you feel. Also women. Next. Okay, one of the good drugs is Viagra. It works. Again, it meets the criteria. It's expensive though, but it works. Very few side effects. Been using it since 1997 when it came out. Next. Okay.
It's getting warm in here. Is that
What's that?
I heard you can't use it.
Well, you can't use it if you're taking nitrites
No,
for your heart. You can't use that. But most people don't. But you can take it with high blood pressure or whatever. I've treated hundreds, thousands. In fact, I was the first one to combine. See, I had men. I was the first one to use it. One of the first people to use Viagra in the patients, and also myself. Now, what I found is the men would say, "Okay, doc, it's great. I have the turgicity. I have the good erectile function, but I don't really care that much anymore." Okay, so remember, erotic love is a spindle. And what's erotic love but testosterone? I was the first doctor in Southern California, maybe who knows where, to combine testosterone, that's erotic love, the fantasy, the ejaculatory volume, all of it, and the good erectile function. And I help a lot of men that way. Okay, now, I can tell any man in this room, anybody listening to me, that I can maintain their erectile function forever. Okay, there are things we can do now that will keep your erectile function forever. Hey, man, it's going to be easy for living for a long time, really. No, really. In fact, it brings to mind, there was a famous old-time movie star, Jean Harlow. I'm sure you've heard of her.
Oh, yeah.
Okay, and she married a director, and he was impotent. He had this beautiful wife, and he can't do anything. He shot himself, blew his brains out. Well, if I would have been there, I would have fixed him. Not only that, if Michael Jackson would have chosen me as his doctor, he'd still be here. I don't know if you mentioned that board-certified anesthesiologist. That was such an obvious flubber. A cardiologist. Okay, hormones.
I do that to my wife all the time.
Hormones. This is the latest research. Hormones may be responsible for love. I already told you about testosterone being the hormone of desire. But now, this is so cool, they've discovered this. There are 2 times in a woman's life that she secretes oxytocin. Oxytocin is a female hormone. She secretes it when she has a baby, and it's one of the things that causes the uterus to contract and stop bleeding. And immediately, that hormone, they've proven this, that hormone immediately attaches her to that baby. And within 3 minutes, because they release that hormone, she'll give her life to that baby. The hormone, oxytocin. Now, another time she secretes it is when she has a climax. So she knows, Mother Nature's saying, that's the right guy. Hormones. Dopamine is what's secreted when you see someone and they giggle or whatever happens. Dopamine. Serotonin is released when you eat carbohydrates. Serotonin is the same thing as in Paxil, Zoloft, whatever. It's the fuzzy, okay? And so hormones are very important, and they can be, no matter what you've heard, they can be given safely to men and women. And with the new longevity, people are living to be 70, 80, whatever. So the women, they're out of hormones at 50, or we stop working. So let's say they live another 30, 40 years. Men, they're starting to really get suppressed in their 40s. So with all this misinformation, people are afraid to have their hormones replaced. Hormones are basically how we feel. They affect our muscle development. They affect everything. Stamina, joy,